It's not easy. When you're suffering, when you've been suffering for so long, finally coming out of that shell and telling someone ki, I think there's something wrong with me and I need help. If it is responded ki, no, you're just, overthinking it, or it's just in your head, that person also feels dejected ki ek jane ko maine help mangi thi, I did not get a good response, so what's the point? And we should never, I think, be responsible for someone to reach that level, that what's the point, nobody is going to help me anyway.
Understood. And also there have been a lot of documentaries recently and a lot of stories from the past where a lot of entrepreneurs and influential people have spoken about their phase of psychedelic and how they have seen multiple dimensions or ideas or had figured something out. Hello everyone, my name is Pranav Vashistha and this is the Gut Feel Show, a podcast on mental well-being where we invite guests from all walks of life and we discuss different aspects of well-being in their profession and in their life. Our today's guest is a psychiatrist, Dr. Madhura, and we discussed about the differences in a psychologist and a psychiatrist, what is self-harm, and what are the symptoms of a mental health problem. We also discussed about the theory of psychedelics. Please keep watching till the end and subscribe us for more such interesting content. Hello, Dr. Madhura. Welcome to the Gut Feel Show.
Thank you so much, Pranav.
How are you doing?
I'm doing good, adjusting to the temperature actually.
Oh, yeah, I'm sure. Okay, so I'll begin this conversation with this thing about your journey itself. How did it start and how did you get into psychiatry?
I think when we are in medical school, you're not that exposed to psychiatry, to be honest. So it wasn't ever an option for me. My mother's a practicing doctor, so I always sort of thought that I'll do what she is doing and I will step into her shoes. But during, I think, my internship, that is when I experienced anxiety personally for the first time. And being a medical student myself, I could not recognize the symptoms. I could not understand that what I am going through is actually pathological and I should, see someone for it. So that is how it started. That is how I started researching about my own symptoms, about trying to understand that, why such a young person who seemingly has everything according to the society. I was doing good in college, I had good friends, a supportive family. So why am I suffering mentally? So that is when the research started and I started understanding that it particularly does not have anything to do with your background, and what you're doing in life or where you come from, and it can affect us all equally. So when I saw a professional for the first time, I really liked what they did and how much it helped me and helped me transform into a better version of myself also. So that is what intrigued me and I thought, oh, this is a really good option for me to do.
Wow.
So yeah,
so that motivated you to take it as a profession.
Yes, definitely. And I remember the first time I spoke to my mother also that I don't want to do what you are doing and I'm going to do psychiatry. And I thought she's going to get really angry and she's going to be like, I always thought we have always planned about your future that way. But she was really supportive and she told me that, whatever you like to do, you should go ahead and do that. So that is how I got in.
Great. So you're coming into it with passion.
Yes. Pretty much so, and I would say anyone who comes into this field has to have a knack for it as well, because it requires a lot of patience, as you know.
It does. It is daunting when it comes to this subject. It's not easy.
Yes.
Also, Doctor, I want to bring more light to this topic where people get confused about a psychologist and a psychiatrist. Can you please elaborate?
That is actually one of the most common queries any common person has actually, and both of them are mental health professionals, as we know, but technically speaking, a psychiatrist is someone with an MBBS degree that has the prefix of a doctor in front of them. So what is different with psychiatrists is they are able to diagnose, officially they're allowed to diagnose a mental health condition and they are able to prescribe medications, that is pharmacotherapy. Whereas psychologists may have different, like clinical psychologists usually have an MPhil or a PhD degree, and counselors are MA or MSc in psychology. So they also help with therapy and rehabilitation of patients, but the only difference is they are not able to give a proper clinical diagnosis, at least the counselors, and they are unable to prescribe medication. So when a patient comes to us, someone with a mental health condition, it has to be a collaborative effort from both sides, a psychiatrist and a psychologist.
It's a teamwork.
Yes, definitely.
Because the patient then transitions into therapy eventually.
Yes.
So I'll elaborate more on this. What is the journey of a client like when they start into seeking help? How does it start and where do they lead eventually?
I think again the confusion starts right at the beginning, that whom do we go to?
Yeah.
Do we go to a psychiatrist? Because there's a lot of fear that if we go to a psychiatrist, wo to dawai denge.
Correct.
Right?
There's no clarity on this. People
There
get
is
confused.
not. And people need to also understand that us as psychiatrists also are equipped and trained to provide therapy as well. So just because someone is coming to us doesn't necessarily mean that we are going to write medications for them, right? If there is no requirement, agar zarurat nahi hai dawaiyon ki, so there is no point in prescribing medication. However, whatever mental health professional you go to, usually the first couple of sessions that or conversations that you have with them are going to be about your general background. Where are you coming from? What kind of occupation and what area do you live in, because these are important factors as well. And after that is when we dive deeper into what issues are you facing currently. Right? Once we have that, we'll also go into a lot of your background in the past, like your childhood, your upbringing, what kind of friends you had, how did your personality become, turn into the one that you have today. Once we have a good in-depth knowledge about who you are as a person, that is when we can form a diagnosis and form an eventual plan as to, what works. Do we actually need medications? Do we, just counsel and help in those terms?
But also at times, if a person is in a severe condition, I believe it is good to opt for a medication rather than falling into some dangerous trap. Because people do fall into wrong traps of addictions or self-harm. A lot of things happen.
Right.
So how difficult is it for a person to get convinced on this? Because it's a big stigma and taboo. हमें like alcohol addiction के लिए it's okay, people get into that. Raat bhar Netflix they'll watch, it is okay, they'll get into that. There are multiple escapes people get into.
Right.
But medication में इतना बड़ा the people get scared कि ये क्या है. So how do you tackle that?
So when you or us, people like us, call it self-harm, for them it is sort of like a self-soothing or a self-medicating mechanism, right? And I don't think anyone who starts drinking or watching, Netflix or gaming or whatever kind of escape they are finding, nobody at the beginning thinks कि अब ये तो addiction level पे जाने वाला है.
They don't even know.
Exactly. But I think what is important to understand even when you are engaging in these activities is वो आपके day-to-day activities को कितना affect कर रहा है. If you are someone who's missing on work because you're drinking or because you drank a lot the previous night, you are unable to socially engage with your friends, your family. If someone from your closed group is also coming and telling you that thoda sa zyada ho raha hai, that is when you need to see these signs as something that is affecting your daily life and day-to-day activities as well. So however, not going to judge anyone who goes into those kind of coping mechanisms, because of course these are easily available also, right? After a certain age, in fact even when you're below the legal age, you are able to access.
It is readily available.
Exactly.
It is readily available all around. The thing is, there is no moderation around it and there is no stigma and taboo around it.
Right, exactly. So while you are doing all of that, you need to ask yourself the questions that it is giving me temporary relief, right? And if I have to go back to something again and again every single day, then it is not healing or solving the problem. It is just giving me that temporary relief and आप problem भूल जा रहे हो. When someone drinks and is able to sleep peacefully, that is when majority of the patients who come to us, even with alcohol dependence, usually their thing is कि इतने दिमाग में विचार आ रहे होते हैं कि if I drink, I'm able to calm those thoughts and go have a good night's sleep. Or if someone who is consuming cannabis, for them the same. So we have to let them know that also कि भले ही आपको temporary relief अभी मिल रहा है, in the future it is going to definitely come back and bite you. It is going to have adverse effects on your health. So why not find a solution that is one permanent, more than permanent, that is sustainable, that you can carry with you along your life, learn the coping mechanisms, and जो ये recreation के लिए है वो आप recreation के लिए रखो, right?
But also, doctor, this thing that you're talking about comes after a big amount of awareness.
Yes.
Because normally people don't even realize the things you mentioned. They just go by.
Right.
So what is that moment when people start realizing that this is a problem that I now need to address or find a solution to? Is there a pattern to that? Is there an age group to that?
I wouldn't say there is a particular age group per se. Majority of the patients unfortunately come to us not by their own will. I will tell you this very honestly. Majority of the
because sadly the system is so restrictive that they land up to you only after an extreme.
Yes. So if they are coming to us, either they are being brought by someone, या उनको काफी बारी ऐसा होता है कि access बंद कर दिया जाता है, right? So once you do not have access to alcohol, you are going to start having symptoms of the withdrawal. So once you go into those symptoms, जब physically आपको दिखने लग जाता है effects कि अभी alcohol body में नहीं जा रहा है, that is when they come to us. And so even then,
that is when the reality hits them.
Right, but even then, when patients come to us, it is usually like कि बस उल्टी जो हो रही है और जो the shivering that I'm feeling, वो कम कर दो. That is all. So they don't come with the motive of quitting per se, because people don't understand.
They want a temporary relief.
Yes.
And I have also seen that over time, a lot of patients are also landing up into places like a person with a sort of a stomach issue will land up to a gastroenterologist.
Yes.
Some people go to a cardiologist, but they will not go to a psychiatrist for an anxiety because they're just hiding it around with other things.
I think it's also very difficult to accept the fact, because there is such a certain stigma कि if you have a mental issue, आप weak हो, right? अगर आपको कोई psychological problem हो रहा है, if you have anxiety, you're inherently a weak person. When you start thinking on those lines, you will never come around to the fact that मुझे कुछ psychological problem हो रहा है.
So it is that feeling or fear that people will judge me, and
more than judge, also I will judge myself that I am not enough, I'm not strong enough. Why am I not able to cope with this? Even when two people are in similar situations, same job, same kind of lifestyle, why is one person able to cope with it and one is not, right? That is where your entire backstory comes into picture. How you have grown up, how you have, faced situations in your life, what kind of traumatic experiences you have had when you were a child. All those things are very, very important in just you becoming a complete adult human being. So when we say कि अगर दो इंसान एक ही situation में है, but one has anxiety and one does not, it is not that person's fault, or that does not make them weak. Right? So we have to kind of raise awareness not just about the mental health conditions, but also the fact that if I, as a doctor coming from a good family, supportive background, can go through an anxious episode or have clinical anxiety, anyone can.
It is normal. But one more thing, when we say that we go back to the history, we trace it back to the childhood a lot of times. Is there a certain kind of trait or a personality that either by good parenting or by a good ecosystem is a personality which is less vulnerable to fall into psychological issues? Or what I mean by that is more emotional intelligence as a child, helpful in becoming more capable in sort of getting up or asking for help, these kind of things. Is it like that?
Definitely a good nurturing environment when you're a child. Having that support, having that constant, I guess, positivity around you is very, very important.
Okay.
But certain genetic factors we cannot take out of the picture completely.
Not about the genetic factors,
right?
But certain things which are in control of good parenting, good teachers, mentors?
Definitely. Because I will tell you very simple examples. Let's say one person has a genetic, predisposition कि anxiety disorders घर में family में run करते हैं, and they are genetically more vulnerable to develop anxiety. So I'll give you in detail कि these children you will see कि usually don't go too away or stray too far from their parents. They are usually stuck to their parents. Nail biting issues होते हैं, bed wetting issues होते हैं when they are children and toddlers. And thumb sucking is another issue. Going to school becomes a big anxious, a trigger for them. So this person, if they grow up in a very nurtured and supportive environment, जैसे parents are considerate of the fact that my child is a little bit of an anxious child. So how we nurture them, how we raise them in that particular supportive environment, this person can never go into an anxiety disorder.
Yeah.
There are chances that they will stay like an anxious personality, but clinical disorder होने के chances बहुत कम हो जाता है. But similarly, if we take one child who's very outgoing, always extroverted, fun-loving, cheerful, कोई anxious traits नहीं है, but let's say in their life they go through environments or situations while they are growing up जहाँ पे they keep getting triggered, they might end up developing an anxiety disorder when they are an adult. So of course your environmental factors play a major role.
And also, doctor, nowadays people are generalizing a lot of things. Like they self-diagnose. मुझे OCD हो गया है, मुझे ये है, मुझे वो है. So is that even okay? Because a lot of people just Google and self-identify and find a solution on Google again. What is happening on this front?
I think with the increased awareness, I would say especially post-pandemic, COVID के बाद और ड्यूरिंग कोविड मेंटल हेल्थ के ऊपर बहुत फोकस बढ़ गया था. सो ऑब्वियसली सोशली आइसोलेटेड थे, वी वर ऑल स्टक एट होम. So during that time a lot of people faced a lot of psychological issues as well, and with that awareness also comes थोड़ा सा generalizing factor, right? So as you said, a lot of people, कोई किसी को अगर थोड़ा सा perfect चीज चाहिए, मुझे OCD है.
Correct.
और exam के पहले जो normal
people are speaking about it as if it is a joke.
Exactly. But I would still say that if you are overdiagnosing yourself and going to a professional, finally actually understanding कि ये मुझे है या नहीं है, that is still better than ignoring the symptoms, right? So we do have people who come with queries and questions. Of course, there are certain people who just keep that diagnosis. Google ने मुझे बताया I have OCD and do nothing about it.
They keep it for the fun sake.
Yeah. बट वी कांट, हम हर किसी को जाके तो नहीं सिखा सकते कि ऐसे मत बोलो. आई वुड स्टिल से दैट द लैक ऑफ अवेयरनेस इज आई गेस कंपैरेटिवली less favorable, rather than having more awareness. But yes, this is a downside of increased awareness. कोई भी चीज जब बहुत ज्यादा सोसाइटी में बोली जाती है,
plus readily available information.
Exactly. So I think it's okay as long as you are not belittling someone else with the genuine problem. Matlab, if I have someone in my group or in my in my colleagues who has an anxiety disorder, and if I belittle them saying कि तुझे क्या है, मुझे भी तो anxiety है, that
is the problem.
That becomes a little bit of an issue, and handling that issue is again our job as well.
And a lot of times when people are seeking help, a lot of people in the friend circle, and even at times people get confused if it is attention or they are actually struggling. How is there an identification for that, or both come from the same line of thought?
What I genuinely feel is attention seeking is also a sign for help.
Yeah.
Right? True. If someone is asking for attention, is because probably they are deprived of it.
Yeah.
Right? You call it whatever. You call it attention seeking, you call it drama, you call it faking. आप जो भी बोलो, but actually understanding the need of the person, कि why are you going through that? Why are you? Once I read or heard someone saying this, that if someone is coming on in a public forum or in a public space and talking about their problems, instead of saying कि अरे कितना प्रॉब्लम्स के बारे में बात करेगी, ask them, are you okay and are your problems getting solved, because you're constantly talking about your problems and I don't see you getting better. So is everything all right? And I think having that empathy and kindness towards another person, it's very easy for us to say कि अरे attention seek कर रहा है, नाटक कर रहा है, right? But
that is how kids get bullied in schools these days.
Right.
A lot of bullying is happening because of this, because when a person, a lot of suicides are happening.
Right.
Because when a student is actually trying to seek help within their peer group, they're bullied by saying these things.
Right.
So it actually means that someone should have empathy and at least figure out a help for them, or directly if they can at least take them to some
when we speak of children, I don't think they will have that access also, but just having, and I feel children are much more empathetic compared to as we grow and become teenagers or adults. अगर आप बच्चे के पास जाओगे और उनको बोलोगे कि मुझे चोट लगी है, they would immediately react in the way of help. But if we same thing, if I go and tell one of our friends or colleagues, अपने peers को अगर जाके बोला कि यार मुझे चोट लग रही है, बहुत दर्द हो रहा है, the first reaction you would probably get is अरे क्या रो रहा है, right? कि इतनी सी चोट पे क्यों इतनी बड़ी बात कर रहे हो? So I think that approach is also very different. कि अगर कोई सामने से आके बोल रहा है कि चोट लगी है, probably they are in pain, that is why. अगर पेन नहीं हो रहा होता तो क्यों बताते?
So it is something that is causing it. And we need to figure that out, or someone who is in their circle at least can help them figure out.
I think being more conscious about how you respond to someone who has come to you for help, because it takes a lot of effort to go out and ask someone for help as well. It's not easy. When you're suffering, when you've been suffering for so long, finally coming out of that shell and telling someone ki, I think there's something wrong with me and I need help. If it is responded कि no, you're just overthinking it, or it's just in your head, that person also feels dejected कि एक जने को मैंने help मांगी थी, I did not get a good response, so what's the point? And we should never, I think, be responsible for someone to reach that level, that what's the point, nobody is going to help me anyway.
Understood. And also there have been a lot of documentaries recently and a lot of stories from the past where a lot of entrepreneurs and influential people have spoken about their phase of psychedelic and how they have seen multiple dimensions or ideas or had figured something out, but a lot of people get misinfluenced by that. What do you say about that? What is that culture, that hippie culture that got seeped into a lot of young generation?
I think anything that is not scientifically properly researched should not be overdone. Of course, we cannot go and micromanage and stop everyone from trying psychedelics or recreational drugs. Having said that, there are a lot of researchers who are still working on this as well. But everything in moderation is okay. When we also treat someone with ketamine, let's say severe depression, we do have studies that show that ketamine is useful. But there are no studies that say that LSD or methamphetamine or MDMA is properly useful or can be. Because of course with that comes a very very high risk of dependence. है ना? So एक बार use किया, I guess having that litigation on that, having the proper restrictive measures of availability may be done in the right situations. Now when we also administer certain drugs to patients who are the drugs that are very high risk, that is done in a proper setting. Everything is monitored. अगर हम किसी इंसान को कीटामीन दे रहे हैं या कोई extremely strong drug दे रहे हैं, there will be 3 and a team of doctors available there. Everything will be monitored, how the person is reacting. Doing that at home, you put yourself in such a risk. It's such a great risk.
It might trigger a very wrong episode.
Exactly. And you don't know, because these are very potent drugs that you're talking about, and they are going to play with your mind.
Absolutely.
They will convert and change your brain chemistry to an extent that we also do not know. So हर चीज monitor करना भी बहुत जरूरी है. There are of course people who are still, there are scientists who are still trying to find and gain the efficacy of these drugs, that the psychedelic especially. But जब तक it is not regularized, it is not brought into proper moderation, तब तक I don't think I can comment more on that.
Yeah, I think what I feel is that it has it might have worked for a few people, but we don't know in what moderation or what quantity they took it.
Right, exactly.
And like you rightly mentioned, a lot of labs are doing research on this, because in moderation they work like medicine in some cases. But it is, if you take it from the street, you might mess up with your mind, and you don't know the repercussions you might.
And you don't know what you're actually getting from the street.
Yeah,
also.
and it might not be undoable. Like you might not even go back from where you have landed to.
And if we talk about these drugs also, what are they exactly? They are just the neurochemicals that we are finding in the brain. So जो हम medicine देते हैं, exactly they are same but much safer and studied. That is the difference. So what you're doing with MDMA, if you take an SSRI, which is an antidepressant, you're going to have the same effect without the repercussions of the side effects and the risk of dependence.
Because that is properly resourced and it helps you regulate certain things.
Right.
It has a sequence of events that are designed to act on certain things.
And we know what to expect when we are giving.
As an expert, it is coming from an expert. That means it is going to act on a certain thing.
Yes.
Okay, understood. Also, doctor, now I would like to do an activity with you where I would like to know symptoms of a few things.
Sure.
So what is the symptom of an anxiety attack?
I think one of the most common symptoms is difficulty in breathing. You feel like there's a weight being kept on your chest and you're unable to breathe. There may be tremors, you may shake a little, sweat, your palms may get sweaty, your mouth gets very dry. So these are some of the common symptoms of an anxiety attack. Of course, multifold severity can vary.
And a symptom for social anxiety?
One of the most common and the most important thing you need to remember about social anxiety is the fear of embarrassing yourself in public, and that is why it leads to avoidance of going in public. So there is a fear that if I go out, people are going to watch me do something embarrassing and I will humiliate myself, so I would rather stay home.
Understood. And a common symptom or a symptom for OCD?
OCD is again a group of symptoms like obsessions and compulsions. So obsessions, when I say, they are intrusive thoughts, but not intrusive in the sense कि पढ़ाई करना है, fail हो जाऊंगा, because that is reality based, right? There are some, if you know, one of the most common symptoms which is publicly known as well is hand washing, right? So हम जब बोलते हैं OCD कि लोग हाथ धोते हैं, the actual act of hand washing is a compulsion, but the obsession that comes behind is that my hands are dirty. Now realistically, you know your hands are not dirty, but there's a constant thought that is like, no, my hands are feeling dirty, my hands are dirty. So the compulsion that is followed to that obsession is going and washing your hands.
Understood. And a symptom for eating disorder?
There are different types of eating disorders. If we take the most common ones, anorexia, let's say, anorexia nervosa, there is again a very obsessive thought that I am fat or I am overweight, which leads to severe dieting behaviors and severe exercising behaviors. If people are forced to eat, then they will go and forcibly remove the food from their body as well. Maybe overuse of laxatives or forcibly vomiting. So these are some symptoms. Bulimia is another eating disorder wherein there's overeating. So there's binging, which is followed by these activities of
so
vomiting.
You eat and you regret.
Yes. So anorexia, I would say, is more severe because you're not eating and जितना आप खा रहे हो उतना भी आप निकाल रहे हो. Yes. So there's a lot of nutritional problems that happen.
Okay. It was great talking to you, doctor.
Same here.
Thank you for coming on the show.
Thank you for having me.
Thank you for watching till the end. Please comment करके हमें बताइए कि आपको ये podcast कैसा लगा और आप किस टॉपिक पे बातें करना चाहेंगे या सुनना चाहेंगे हमसे. हम उन लोगों को अपने शो पर लेकर आएंगे एंड मेंटल हेल्थ के बारे में इन डेप्थ डिस्कशन करेंगे. Please like, subscribe and share with at least one person because your share can help that person improve their mental health. Thank you so much.